Congenital fanatics question. Post-rehab disc bulges, stronger back and core, foot tingling still persisting. So again, this is where it all comes down to the first thing you do before you begin rehab is if you have like a foot tingle, for example, is it definitely coming from the disc bulge? Or is it coming from potentially stenosis or inflammation in the bones around the area or the facet joints? Or is there a muscular component to it? And again, the way you answer that question is by having a thorough assessment at the very start. We can actually tell, we can actually test and see, without having to guess, what the actual cause of the problem is. Once we actually understand the problem and why it's there, then everything else becomes pretty clear going forward. The mistake people do is they say they have like a foot tingle and they may say, you know, doctor may say, look at MRI scan quickly and say, well, we have a disc bulge, it's probably that. Go and have that operated. You've still got foot tingling going on. Obviously it wasn't the disc bulge. So again, if we use, for example, Schmidt-McGill's provocation testing, we can test mechanical positions to differentiate between, well, is it actually a disc bulge or herniation that's causing the foot tingle? Is it more stenotic? So if we put it into extension, do you get more of an issue? Or is it muscular? Like if we loosen or activate certain muscles, does it change that foot tingle? Because again, a foot tingle is pretty ambiguous. It could be, you know, muscular, myofascial, it could be circulatory, you know, it could be anything when someone just says the word foot tingle. We'll have to test and work out exactly what it is. But then when you do proper testing in person, you can actually, you know, use a provocation testing, it will tell you why it's actually there. And again, before you try and solve the solution of the back pain, understand it clearly, understand why it's there, otherwise you're just kind of guessing. So, you know, there could be a few reasons. So for example, if you had the disc bulge operated on and it's definitely gone, there's no pressure from a disc bulge, check extension and see if it's stenotic in nature. If it's not, then we have to check the muscles and see, is it a problem within the foot itself? Is it from the calf? Is it potentially from the hip, like the muscles in the hip? People can have issues with piriformis and glute medius that will make the lower leg feel weird and have weird issues and circulation problems. Again, there's a lot of things it could be, but we need to is, again, the solution to it really is to have a thorough assessment first of all, and then we know what to do because the roadmap sort of gets drawn for us almost going forward from there. So as always, you know, it depends. You've got to answer the it depends bit with thorough investigation.